Hi COVID-19 vaccine providers, Dr. Fricchione again from the CDPH immunization program. This is part of a series of update videos that CDPH will provide as we move through the vaccine phases in Chicago. Here are some tips for preparing to make the most of each and every day we have to stop this pandemic. Work to administer all doses received each week within the week. If you haven't already, start scheduling appointments for 1B patients or those who self-certify as part of Group 1B today. Moving forward, you'll schedule and order doses a week ahead, so we recommend having a waiting list in case you have extra doses at the end of a clinic, with the clear understanding that vaccine supply could change. Establish standing orders to expand and maximize your vaccinator workforce and drastically increase the number of individuals that you can vaccinate. Remember to vaccinate at every opportunity. This means normalizing vaccine distribution in the office to provide it to as many 1B patients as possible. Run reports in your electronic health record or in the state registry, iCare, to call your highest risk patients to actively schedule them for appointments. Remember that phases overlap, and individuals in an earlier phase remain eligible to receive COVID-19 vaccination in later phases. After intensive and appropriate efforts to reach the prioritized groups, facilities can offer vaccine to persons in lower priority groups when doses are about to expire according to labeling instructions. Remember that there's no maximum interval to give these mRNA vaccines. But even so, you should schedule patients for 28 days from their first dose before they leave the office. Do not waste COVID-19 vaccine. In order to do that, you must ensure proper storage and handling and careful scheduling with timed vial opening to avoid unused doses. This is where a waiting list can also help you to maximize the number of people you vaccinate. As always, the latest information is on chicago.gov/COVIDvax and chicagohon.org/COVIDvax. Thank you for all you have done and will do to support our COVID vaccination program in Chicago. Your efforts, combined with 6 currently open CDPH mass vaccination sites, strike teams starting to vaccinate high-risk congregate living settings, and Protect Chicago Plus street outreach teams, we can and will protect Chicago together.